So now we're going to jump into the muscles. So the first one, we're going to start with a couple of the big ones. So we're going to start here on the back side of the body. So realistically, your trapezius and your lat, they cover, your latissimus dorsi, they cover most of what's on the back, right? So we don't realize how big the trap is, because in the gym, what do we do for traps? We do shrugs, right? So we think of the trap of just the upper trap, but it really comes all the way down to T12. So the way you're gonna find that is you find that last rib, it's kind of here in that soft space, and then you follow it over. So that's about where T12 is. So that's how far down the trap's gonna go. It's gonna come from the back of the head, the occiput, which is the bump on the back of the head here, and it's gonna run all the way down. So it connects there, the ligamentum nuchae, and then it goes C7 to T12, right? So that's all origin for the trapezius. And then it comes out and it attaches out here at the acromion, the spine of the scapula, and the lateral part of the clavicle. So it wraps around here. So if we wanna see the trap, I can have him shrug, and you can see the trap pop out right here, and you can kind of palpate it there, but it is running all the way down here. So it's covering up all that stuff. Relax. It's covering up all of that stuff all the way down. So that's the first one. So then the next one is the lat. So that's going to be the big muscle, you know, that you're going to think about when you do, like, say, a pull-up or a row or something. So it's going to be the big muscle right here. Same thing, it covers up a lot of what's on the back. So later on, when we get to the back chapter, all the stuff that we palpate are deep to these two muscles that run along the spine. So that one's gonna come, you have a big fascia down here called your thoracondylar fascia. So it's gonna attach there, it's gonna attach at the iliac crest, it's gonna hit the inferior angle of the scapula and a couple of the ribs, right? So it attaches all the way down through here and it runs underneath. And what's interesting about it is it actually attaches over here on the front side into that intertubercular groove. So it's gonna come over here and attach. So if you think about the movements that you do in the gym for it, right? So pulling down, it's gotta attach out on the humerus, right? Otherwise, why would we move our humerus to work it? So anyway, so it's again, another big muscle that's gonna run through there. The third big muscle that we have up here is the deltoid. Its primary movement is gonna be abduction. If you're doing anything really with the shoulder, it's active because you have an anterior portion and a posterior portion and a middle portion, but its big movement is abduction. So its origin is the same as the insertion for the trap, right? So it's the lateral third of the clavicle, the acromion, the spine of the scapula. So it kind of cups around the shoulder again, and then comes down to that deltoid tuberosity that we talked about with the bony landmarks. So it just covers that space there. The next muscles that we're going to talk about are the rotator cuff muscles. So we're going to find those from the back side. There is a picture in the book that shows using your fingers and using it out on closer to the outside of the humerus. I like to start on the scapula though, because I think it's easy. So you find the spine of the scapula. So just above the spine of the scapula, that's where that supraspinatus sits. And it's going to come out, it's going to come from the supraspinatus fossa, and it's going to come out to the greater tubercle, right? The infraspinatus is going to come from the infraspinatus fossa, and it's also going to come out to the greater tubercle. Your teres minor, so we come out and we find that inferior angle, and we work our way up the lateral border, and it's the upper portion of the lateral border of the scapula, also comes out to the greater tubercle. So all three of those are coming there. They're going to help hold the humeral head into place, as well as help with lateral rotation. Now the fourth rotator cuff muscle is the subscapularis, so it's going to sit anterior to the scapula in that fossa, remember where we put the hand on the back and popped it out? So it's going to sit in there, so it attaches in the subscapular fossa. It comes out to the lesser tubercle, so remember that's going to be that one that's tucked in here. So that's the four rotator cuffs, so supraspinatus, infraspinatus, teres minor, and then subscapularis. So, and they're all coming out, three of them on the greater tubercle, and then the subscapularis on the lesser tubercle. Another muscle, not to get confused with one of the rotator cuff muscles, is going to be the teres major, right? So remember, we found the teres minor is the upper portion. Teres major is going to be lower portion of that lateral border, and it's going to come out and attach on the humerus as well. It's going to be hard to differentiate that from the latissimus dorsi. It kind of runs along with it, and the movement's about the same too. So it's going to be hard to distinguish that one there. So now the next one that we're going to talk about, here, spin around, is the serratus anterior. So the serratus anterior is going to be the muscle that kind of comes around. So you can see it on really thin people where it comes around, it kind of looks like fingers and it attaches here. It actually runs from way up here. It attaches at the upper 8 or 9 ribs. And then it comes and attaches on, so that's the origin. And then the insertion is the anterior medial border of the scapula. So its job is to help hold the scapula down. So if you have weakness there, when you do a wall push-up or if you do a push-up, what'll happen is you get winging of the scapula where it pops out like this and points out instead of holding down like it's supposed to. So that's that one. So now we have some muscles on the anterior side that act on the shoulder. So first is the big easy one, right, which is the pec major. So that's going to be the big one that attaches on the upper 6 ribs and at the sternum, the medial part of the clavicle. So it's all here, and it's going to come out and attach at the crest of the greater tubercle. So the crest of the greater tubercle is just, you find the greater tubercle and it's just below it, right? It's a big bump and it gets smaller, right? So it attaches out there. Again, if you think about the movement we do in the gym for it, which is going to be like push-ups or bench, it's got to attach on the humerus. Otherwise, why would we move the humerus to work it? So it's attaching out there. So that's the big muscle up there. Now we have the pec minor, which is going to sit beneath here. That's going to attach at the 3rd, 4th, and 5th ribs, and it's going to come to the coracoid process. The coracoid process, the way you find the coracoid process, it's the lateral portion of the clavicle, drop just below it, and you got to dig in. It's uncomfortable on a lot of people to find it, but it sits right in there, and it's pretty deep. Some people it's pretty prominent, other people it's just like a kind of flat, right? So it's going to stick right there. You can sometimes extend a little bit to expose it, but generally just keeping that pec as soft as possible and digging in there is your best chance. People who have a pretty thick chest, you're going to have trouble getting to it. You just got to dig in there. So anyways, so back to the pectoralis minor, 3rd, 4th, and 5th ribs, and then the coracoid process. Now we also have attaching at the coracoid process, so while we're on this side, so you have your bicep brachii. So even though when we're in the gym, what do? We do elbow flexion and supination to work that. The bicep brachii actually crosses the shoulder joint. It crosses here at the coracoid process for the short head, for the origin for the short head. The origin for the long head goes up to the supraglenoid tubercles. Remember we talked about that with the bony landmarks. So the supraglenoid tubercle, and it comes down and attaches across the elbow joint. So that's why we do elbow flexion. You actually work your bicep when you do shoulder flexion as well. So it comes down to the bicipital aponeurosis and the radial tubercle. So it's down here. You can feel that tendon really easy if you dig in right there at the elbow. So that's the bicep. Now we also have here on the front side, if we had an armpit muscle, right, we'd have what's called the coracobrachialis. So you find the bicep, you find the tricep, and just right here between it, you got another little muscle here. And that's going to go from the coracoid process out to kind of that medial shaft of the humerus. So it sits right there in the armpit. You can kind of feel it right there. So I can feel it. Dean's pretty easy. All right, so then the next one is the tricep. So flex your tricep. So you can see it's got the heads here. So it actually has 3 attachments. So it's going to be the, it's the origins is going to be the, the infraglenoid tubercle. So it's kind of there in the armpit. That's the long head. And then you have the medial and the short head, which are going to attach basically all the way down the humerus. So that's all origin. And then the insertion, if he bends his elbow, so you have the olecranon process right there. So all the insertion is going to come down to right there. And that is our shoulder.